Hello, I'm Dr. Barry Pecos, York Region's Medical Officer of Health. We have all seen the disturbing images of our acute care hospitals across the province buckling under the pressure of the seventh wave of the pandemic, as well as accumulated healthcare needs and a healthcare human resource crisis. In public health, our role continues to be to do our part and to help inform York Region residents on how they can do their part to continue to decrease this burden. For now, this is a familiar refrain. We need to continue to get vaccinated. In particular, York Region residents who've only had 2 doses can and should get their 3rd dose to protect themselves and to protect others and the system in anticipation of a fall wave. As you will know, all York Region residents over the age of 18 are now eligible for a 4th dose as well. I received mine some time ago, and I encourage you to do the same. We expect that there will be a new bivalent Moderna vaccine coming out this fall that will provide enhanced protection from the Omicron variant. So one can decide to wait for this new vaccine in the fall, which will likely be available in a priority sequence similar to the other vaccines, or to get your 4th dose now. There will likely be a minimum interval between the doses of 3 months. So the sooner you get your 4th dose, the sooner you'll be eligible for the bivalent vaccine. We are excited that we have had an excellent start to the long-awaited vaccine for children ages 0 to 4 years old. In York Region, the response has been great, with eager families booking vaccines for their young ones in special clinics tailored to the needs of young children. Please check back to book your appointments as spots do fill up quickly as they are added. You can book your pediatric vaccine through participating pharmacies or at our York Region clinics by visiting york.ca/COVID-19 vaccine or by calling Access York at 1-877-464-9675. This vaccine is especially important for children who are in daycare or group settings or who are immunocompromised or otherwise vulnerable. But it's also important for those who have older or vulnerable household members and families. In other good news, in York Region and the GATA more generally, we are seeing a leveling off of the COVID-19 wastewater signal, meaning we're not seeing the increases we were earlier this summer. We are hopeful that this will translate into lower cases in hospitals in the near future, but this may take some time. I know everyone has been gathering with friends and loved ones or attending events this summer, which we all need for our mental and social well-being after the past few years. But this pandemic is far from over, and we're very actively planning for a fall surge, not only of COVID-19, but also of other respiratory infections that we haven't seen in many years. For now, as always, our goal is to minimize cases, as low as they can go, to give us a runway for the fall. So in addition to getting vaccinated, please be aware of your own symptoms and isolate if appropriate. That is, if you have any new COVID-19 symptoms like a cough, a cold, or a fever, please remain home and limit your interactions with others. You can reschedule your plans and let close contacts know of your symptoms so they can monitor themselves as well. Rapid antigen tests remain available free of charge through pharmacies and grocery stores. If you have symptoms or were exposed to someone with COVID-19, you can test yourself daily over a few days and swab your throat, the inside of your cheek, and then both of your nostrils to make sure you're getting the most accurate results possible from your test. Though masks are not mandatory in most settings, you can still do your part to protect yourself and others by having a mask with you, especially if you're planning on entering an indoor setting with poor ventilation or you'll be in close contact with others. Omicron variants are still present in our community and are highly transmissible, so please be respectful of those who are wearing a mask and want to protect themselves and others around them. We all want to see the end of this pandemic and of the challenges we're having in the healthcare system. Please know that we can each make a difference.